A new species of COVID-19 is being hunted in Rwanda. It is frightening. The number of new cases of COVID-19 infection is in high speed and increased 8 times compared to the result first week of this week and 7 days ago, with the number of deaths are nearly 3 times more than it was before. Things already get tough in Rwanda. The increase has prompted the government to change its strategy, suspending travel between all the parts of the country, and curfew it is set at 7 p.m. to 4 a.m. No more public traveling except the one with a special emergency, and just from today, 23rd June 2021, new laws, strategy, and regulation were put in place to take the measure of COVID-19 not to spread further. In the past 7 days, the total number of new cases infection is at 3,384, with 20 people who killed by. While the first week of this month, the total number of infected was 411. Today, as I'm speaking, 861 patients available. On Tuesday night, the Minister of Health announced that about 861 new cases in total. Unfortunately, 400 patients were found in Kigali. There is a huge number of people than it was before. That is why we need to do an adjustment in our strategy to put measurement on going for the benefit of our health as a whole. After all, people with various income had said to go back in the village to stay with their parents and stay in heritage for the sake of not being dead but hungry. Emeritha Mukamunana on Tuesday was among of many people who left Kigali to turn to their home in the province before the government laws and the new strategy put in place to take COVID-19 measures into action. It was difficult to find a car. I had to go home in Ruhango district because I don't want to face too over hardship and lack of bills, she told the BBC. Yesterday at Nyabugogo Spur, it was a bunch of many people want to go back in village to stay with their family. In their mind, they do hold an idea of total lockdown that is going to come in Kigali. They thought the better way to live their lives to go back in village where the basic need don't require much money as it is in Kigali. They thought the best way to also keep developing everything they do had to go were in the place where requires less spending and no more than like here in Kigali. As you see in the video, there's a bunch of many people feel want to go back home, but unfortunately the bus to take them in their destination are very few. Buses are so limited number compared to huge number of people who want to go back. Police thought the way they could help them, but it is very hard and tough since the cars are very few, buses are very few, and a bunch of people want to go back home because they are preparing themselves not to be down with the hungry and lack of means to pay the bills for their cost of living. As they thought that COVID-19 is going to bring new total lockdown, which is a tough time for them. Policemen try to see the way possible to take them to their destiny. The story ends well, some of them managed to go, but others they couldn't because the issue of lacking bus to take them in their final destiny. In Rwanda, they are researching for the outlet type of new COVID-19. 7 days ago, there were a large number of new COVID-19 infections since COVID-19 attacked in Rwanda. It was in March 2020, and there are very many concerns that there is a new COVID-19 species in Rwanda. The new COVID-19 species named Alpha is rapidly spreading more than the other viruses. In recent times, ready to increase its epidemic in various ways here in African countries. New COVID-19 species first discovered in India. It had been an unkind thing for the days in neighboring countries such as in Uganda. The Health Minister Dr. Daniel Ngamije on Tuesday spoke on Radio Rwanda, wishes to meet or bring Indian specialists for help. He said there is still no evidence that new COVID-19 species take hard advantage over Rwandan lives. In recent months, there have been cases of alpha from British and a bit from South Africa, but those people have been treated so well. And again, for them to be alive in Rwanda, it means a lot inside of health care administration. So far in Rwanda, the total number of cases it is 32,206 as well, and unfortunately 27,434 was affected in the last 4 months. Deaf people are almost 392. Total number of people who already vaccinated are 400,000. Rwandans are being prepared for another stay at home. It is a sign raised by Minister of Health Dr. Daniel Ngamije. The Minister of Health Dr. Daniel Ngamije has warned Rwandans that they are moving towards stay at home if Rwanda does not change their behavior recently. In an interview with RBA with other ministers, police spokesman on Tuesday, Dr. Ngamije said there was disregard in public and population, as well include institutions, lead to increase in number of COVID-19 infection and death. We are waiting for a lockdown. Reason is if we do not change our behavior, we will stay home completely, said Dr. Ngamije. To remind us all about our time we have been going through during stay home. If we had learned a lesson we couldn't disregard. He said people disobey orders when they saw that vaccines are coming, and started going to bar, weddings, other public gatherings, and there were no avoidance. Minister Dr. Ngamije said then when the vaccines come in large numbers, there will be an installation, but so far now, no more 10% of those to be vaccinated will get them. He said the worst affected area is Kigali and the Rwanda district, where the number are keep increasing at the high level. Dr. Ngamije said everyone is responsible for reducing the number of COVID-19 and its spread. He said the mother, children, employer, employee, staff member, and other directors, supervisors, and all involved in ensuring that COVID-19 prevention guidelines are followed, while the government expects more vaccines to reach to the population in right time. The Minister of the State for Local Government, the Minister of the State for Local Government, Jamari Vianney Gatabazi, also said that the people and local authorities should take care of COVID-19 patients who are at home, and so that they not spread virus to the people around them and many as well.